I'm Laura Arena. I'm a nurse prescriber and I'm the clinic lead at Nouveau Aesthetics in St Peter Street in Bedford. And this is Catherine. Catherine, tell us a bit about yourself.
Yep, so I'm the skin therapist here at Nuvo, and I have been within the industry for about 8 years now.
Excellent, excellent. And you're an asset to the team. So, for our first podcast, we thought we'd talk a little bit about rosacea and a little bit about what it is and the side symptoms and treatment options and what we offer in clinic for rosacea, what works and what doesn't work so well. So first of all, we'll talk a little bit about what is rosacea. I mean, it's a very general term. We use it all the time, don't we, Catherine? It's like
Yeah.
something that's bandied around quite a lot. So what is rosacea?
So rosacea is a type of inflammatory skin disease. You can get lots of different symptoms from it, whether it is broken capillaries and thread veins, or kind of little raised bumps under the skin, but generally speaking, it tends to be across the cheeks and nose area primarily. It can be quite painful for some people, and others it can just be a little bit of redness under the skin, but it does vary from client to client.
Just at this point, I just wanted to talk a little bit about this podcast and how it's not a replacement for medical advice. We're just giving our own experiences and talking about some of the available treatments that you can have, aesthetic treatments. Which can also run alongside prescription treatments, but also if you decide that you want to try alternatives, but obviously it's not replacing medical advice. So we'll talk a little bit. So Catherine talked a little bit about what the symptoms are and how it presents itself. But so we'll talk a little bit now about what the triggers are. So um, I know that a lot of people, would you agree, say that they notice it more when they're like drinking alcohol
Hmm.
and chocolate things, foods,
Yeah.
sugary foods. So,
Yeah.
would you agree, Catherine?
Absolutely. So, and anything that can raise the temperature, basically in the skin. So, like spicy foods, like you said about alcohol.
Mm,
A lot of people tend to find that it's worse in the summer months because your capillaries are more dilated anyway when you're hot. Being quite
mm,
stressed can also be a bit of a trigger for it. And any kind of active ingredients in your skincare that you're not particularly used to or tolerant to. So it's better to just keep your skincare quite simple to avoid any triggers or flare ups.
okay, yeah. So that's quite interesting. Did you find that people tend to have certain times of the year when they have more flare ups, or does it depend on them? It depends on the individual.
Yeah, I mean, obviously everyone is slightly different, but generally the summer months can be a lot worse
Mm,
because if you are in direct contact with the sun, obviously that's going to warm up the blood vessels within your skin, then giving the appearance of more of that redness. And it also can become quite uncomfortable if you do suffer with the spot-like bumps under the
mm,
skin.
mm.
Also, things like sweating and things can make the skin feel a little bit more irritated. So generally, the summer months tend to be worse for people that suffer with rosacea.
Mm. So before we move on a little bit onto skincare and clinic treatments,
Hmm.
what lifestyle changes? Say somebody came in for a consultation,
Hmm.
they got confirmed rosacea or suspected rosacea. What would you say to them that would help run alongside the clinic treatments and the good skincare? What lifestyle adaptations would you recommend for them, Catherine?
Just yeah, eating a nice balanced diet. There's been a lot of kind of talk about the relation between your gut health and
Mm,
rosacea triggers also. But then yeah, just obviously we can't completely cure rosacea,
mm.
but there's lots of things that we can do to try and treat it and manage it.
Yeah, that I agree with you. That's the thing. I mean, it is about management. It does tend to be a chronic thing. You can, but it's just about managing those flare ups and keeping them to a minimum, really, isn't it?
Yeah.
Sometimes it can be progressive. Actually,
Hmm.
some people it can go on and actually move from redness and vascular sort of vessels through to actual, pustules and
Hmm.
But yeah, it's keeping those flare ups to a minimum. But yeah, it is more about management. I agree with you. Right, so we talked a little bit about triggers and
Mhm.
about management. So I was going to say to you, Catherine, because we do a lot of consultations for rosacea,
Mhm.
and we talk a lot about skincare. So
Mhm.
this is our favourite subject.
Yeah.
So if somebody came in for a consultation and they
Mhm.
wanted to talk about the skincare that they're using, what would
Mhm.
you recommend?
Yeah, so it would completely depend again on the individual client, but generally speaking, we would just strip it right back to a form of gentle cleanser, some type of hydrator, and then a SPF, ideally 50, if not definitely an SPF 30. Depending on the client and how their skin barrier is as a whole, would depend on if you started to introduce more active ingredients such as azelaic acid, potentially
Mm.
some niacinamide. Um, but yeah, that would all depend on if the client has used kind of active ingredients in the past, if they've got a broken skin barrier. But yeah, stripping it right back initially and gradually building in some more active ingredients over the weeks would probably be what we would start with.
Yeah, no, I completely agree. It's about just stripping it right back. Just
Mhm.
start with good cleanser.
Mhm.
Because what we're aiming to achieve basically is just to we don't want any bacteria on the skin, and we
Mhm.
don't and we want to keep the skin, keep the skin inflammation down, don't
Mhm.
we?
Yeah,
And
nice and
so
calm.
cleansing is so important.
Mhm.
And then obviously also because of the UV. Um, UV can obviously cause flare ups as well. So we
Mhm.
just want to, it's important for everybody to use the sunscreen, but particularly if you've got rosacea
Absolutely.
and inflammation in your skin.
Mhm.
Yeah, no, I completely agree. So you started to mention some names there. So we're talking about azelaic acid.
Mhm.
So this is particularly now, I've noticed this is a buzzword that
Mhm.
a lot of people are uh, looking and talking about a lot on TikTok and things like that as one
Mhm.
of these newer acids that is particularly good for things like rosacea and acne.
Yeah.
Would you agree?
Yeah, absolutely. So it's got very like anti-inflammatory and antibacterial properties to it. So it's just going to help to kind of reduce any inflammation that is trapped within the skin, whether that be rosacea or just normal kind of pustule acne.
Yeah, brilliant. Yeah. So these are the things that we can advise on when you come into clinic. So when you come to Nouveau Aesthetics, you would have a skin scan, and we'd actually go through the condition of the skin in terms of texture and oiliness, and all those things, that because it's not just about the rosacea itself, it's also, when you're talking about skincare, it's actually your skin type, it's your it's if you naturally are somebody that's more sensitive, so there's lots of other things that affect it, as well as the actual concern itself.
Mhm.
So it's all about, as Catherine said at the beginning, is it's all about the individual, isn't it?
Yeah, definitely.
Yeah, no, I completely agree. So yeah, the most important thing is getting personal advice for you, and adding things in slowly, because obviously you are going to be more sensitive if you've got rosacea, because you obviously there's an impaired skin barrier there,
Mhm.
and there is a risk of inflammation, so you don't want
Yeah.
to just go too harsh too soon. Would you agree, Catherine?
Yeah, absolutely. And even if you are one of the ones that's lucky enough for it not to be kind of painful or uncomfortable, the chances are you're quite a reactive skin type as well. So
Mm.
you'll get quite a lot of flushing and things. And there are lots of different products that we have that we can recommend, which will help reduce the redness, as well as kind of any inflammation in the skin as well. So, yeah.
Excellent. Okay, so we talked a little bit about triggers, a bit about skincare. So, in clinic treatments, Right, so we've got some amazing things for rosacea, haven't we,
Hmm.
Catherine? I'm very excited about IPL.
Yeah.
So, Catherine, yeah, explain a little bit more about IPL and how that works with rosacea, and what is IPL?
Yeah, so IPL stands for Intense Pulsed Light Therapy, and it is basically a device that we use that turns light energy into heat energy, where it is directed into the skin directly. It will break down any broken capillaries. So, if you've got lots of superficial blood vessels, it will help to break those down. It also has very antibacterial properties. So, if you have got any pustule acne, under the skin, it will help to kill the bacteria. And it just generally helps to rejuvenate the skin. So you're producing more collagen. It can feel quite a like warm sensation while you're having it, but nothing more than like a little tingle and a little zap if there are little capillaries, but it's very bearable. And when we finish the treatment, we will always put the LED lamp on at the end. Again, depending on the client's skin type, will depend on what kind of color light setting we put on. But again, you've got the blue light, which is anti-inflammatory, antibacterial, and then the red light, which stimulates rejuvenation as well.
Mm. Yeah, so they're both brilliant, aren't they,
Hmm.
for rosacea? I mean, the IPL and also the LED mask. I mean,
Hmm.
what I like about them is there's no downtime,
Hmm.
and you can continue to use, your skincare products.
Hmm.
You haven't got to worry about stopping and starting things. Would you agree? Is that a case?
Yeah, most definitely with the LED lamp. Depending on the IPL settings, depending on how high up the kind of chart you get, you might have to just be a little bit more careful for about 24, 48 hours. But
Mm.
after that, generally there's no kind of really redness after the treatment because the LED lamp will help to bring that straight down. So yeah, very, very kind of
Mm.
non-downtime treatment.
Yeah, and excellent for just reducing inflammation,
Hmm.
reducing redness, and they work very well, if lifestyle changes and with good skincare. So it's all about the holistic, isn't it, Catherine? I mean, it's like, yeah, it's all
Absolutely.
about all these things together.
Yeah, most definitely.
No, and anything else? So we've talked a little bit about IPL. We talked about LED light therapy. Was there anything else particularly that you think is particularly good in clinic for rosacea?
So they're like the main kind of treatments that I would normally recommend. But it is going to be your kind of skincare regime that you're doing every single day. That's really going to give you the kind of best, longer lasting results.
Mm.
But
Yeah,
yeah,
that's true, isn't it? Because I mean, it's like
absolutely.
that's the thing. I mean, it is about management, isn't it?
Mhm.
We can help you with these clinic treatments, but it's all about, it's all about it's home care is as important
Absolutely.
as in clinic treatments. But yeah, no, we're very excited about IPL and what we can achieve with that because prior to that, without IPL, it's quite you're quite limited. You've got to be very, very careful with rosacea skin, but
Mhm.
with IPL, you can get some great results, and um, it's an amazing treatment to have. I'm really excited about this.
Yeah, so am I. It'll be good.
So, Catherine, so we've
Mhm.
talked a little bit all about rosacea today.
Mhm.
We were thinking like we're going to do this a bit more regularly, and we'd like to invite you as the listeners if there's anything you'd like to talk about, if there's any particular treatments you're interested in us talking a little bit more about, or if there's anything, any other skin concerns that you'd like to hear a little bit more about, please just leave us some comments, and we'd be happy to have a little chat. If you want to know a little bit more about different skincare ingredients,
Mhm.
because I know it's a bit of a minefield out there with
Mhm.
skincare. But yeah, we're always excited about talking about skincare and clinic treatments. But yeah, so thank you so much, Catherine. It's been a really interesting insight,
Oh, thank you.
and we will chat to you all again soon. Thanks a lot. Bye.